What a story there from Esther Kahumbi. You don't often see journalists in tears, but she was in tears. And before we go into deep health matters, I have to ask you, young girl there saying, you know, she wants to be a doctor, but almost it's society actually has failed a lot of these young people listening to the girl's stories. Quickly, before we go into details on health, what's your response to that story, Dr. Ari?
So I think it's quite touching, and I think we need to expand our social safety net mechanism. Already, as you may be aware, we are doing something about the elderly, the disabled, but I think we need to expand it further so that all these disadvantaged young people are taken care of.
Huge issue, and the question perhaps Kenya should ask is, can we afford not to do it as much as it might cost us? We're speaking with Dr. Nicholas Muruguri, who's the Director of Medical Services. A story we saw before that one on traffic accidents and the number of people who've lost their lives on various roads, remembering the people who lost their lives last year. The big question around that is, what is the state, and we know it's deplorable in most places, but let me put the question to you, what is the state of ICU services in various areas around the country, and how do we make sure that people are getting services in their respective areas for emergencies?
Okay, we must acknowledge that for a long time we haven't really invested in emergency care services. And I'm happy to say that in the next 1 year we are going to see a total transformation of the health sector, particularly how we address chronic diseases and also emergency care. For example, every county, we have identified 2 referral hospitals that are going to be equipped with ICU beds, 6 of them. We are going to have dialysis, we are going to have imaging, MRI, CT scans, X-rays, ultrasounds, to ensure that there's no reason, if you have an accident along Mombasa Road, you need to be taken all the way to Nairobi for a CT scan of your head, so that the doctor in Machakos knows what's going on. So right there in Machakos, there will be a hospital equipped to be able, for the doctor to be able to know what's going on. So over the next 1 year, we are going to transform the health sector completely in terms of diagnostic capacity and how we take care of our people, particularly ICU and also the dialysis.
Is this going to happen at county level? In each county there will be a place you can go where you're sure of excellent ICU services?
So every county, we are going to identify 2 facilities. They've already been identified with a partnership with the county governments, and we are going to ensure those 2 referral county hospitals are equipped from laboratory to diagnostic like X-ray, ultrasound, and some of them have also been identified to be able to equip with 6 ICU beds and also renal dialysis, 6 beds for renal dialysis. So that way, we are going to ensure Kenyans do not have to queue in Kenya National Hospital, because we rightfully believe that and need to ensure that the right to health, which is fundamentally described in our constitution, is actually actualized. So part of our commitment to Kenyan people is to ensure that the health sector is able to provide the kind of service they need near home, where they live and work.
Let's talk about the devolution of health and the challenges that we have seen, and human resource management seems to have been the biggest challenge really on your plate at the moment. We saw the strikes last year, which really paralyzed the health sector across the country and cost some people their lives. Nobody wants to go back there. What are you doing as a government to ensure that you are addressing these HR issues?
First of all, let me at the outset say that devolution is working in the health sector.
It is working?
It's working. There are challenges. We cannot, we cannot ignore that. There are challenges. But largely, it's working.
That is good news. That is good news that you're optimistic. I'll come to some of the specific issues raised, but it's good to see you optimistic.
But if you look at the studies that have been done the last 1 year, number of women deliver in health facilities, in some places has more than doubled, other places are tripled.
Okay.
They come to deliver health facilities because there is good care there. If you look at the number of health workers, extra health workers have been employed by the county government. They have opened facilities that were closed before. Let me give an example. Takaba Hospital. They did the first intersection after 50 years of independence, the first time last year. Takaba is part of the Mandera West. It is a catchment for 150,000 people. There were women there who were dying because they could not be provided this intersection.
Right.
For the first time, it happened. And everywhere we go, new theaters, new wards have opened, drugs are available, and therefore it's working. But the, of course, issue of human resources is a challenge. That is a challenge of transition. But currently we have a working group that brings together national government, the county government, the Council of Governors, the SRC, Public Service Commission, that is trying to address these challenges of human resources. It's real, the issue of delaying payment of salaries, people feeling discriminated and so on. But it's isolated issues. Largely, some places are actually functioning.
So let's talk about that for a moment. It's important perhaps to laud and to hold as case studies the places that are getting it right, rather than pay attention constantly to the places that get it wrong, which tends to be what we do in media. So which counties are getting it right now?
Well, everywhere you go, we have good stories. But I could start. Machakos is working. Nakuru is working. Wajir, they are trying their best. And if you go on places like Kipia, they are also trying their best. If you go to Kisumu County is working. And everywhere you go, people are making the effort to make sure things function. Kisii, a good case study of how things are working. And therefore, if you look across the country, we have good stories to tell about progress in the health sector. Of course, there are isolated instances of challenges, human resource management, drugs and so on. But largely, every county, everywhere you go, you hear good stories about Kenyans accessing good quality care. So basically, right through all the counties, there are places where it's working in a facility, in a district hospital, and you cannot just generalize and say there are issues. Yeah, they are there, but largely these are working.
So you're saying there's progress in spite of the challenges that we may have. So lots of the SMSs coming in referring to corruption within health, and people saying they have to pay for health services where, you know, in cases where they know there are no charges or there are not supposed to be any charges. What can you do to address specifically the issue of corruption? Is that part of what the working group would deal with?
The working group is looking at a number of issues affecting human resources, but also we have other arms of government that deal with these issues, and they are out there working. But of course, this issue isolated one case of people not being happy or feeling they've been cheated. We always like people to report the nearest the nearest authority so that those issues are taken care of. But largely, we have people working very hard. Our healthcare workers in Kenya work sometimes under very difficult circumstances, but they're doing their best to deliver quality care to Kenyans.
Dr. Muruguri standing up for the health workers there. We have all these SMSs on corruption. We will send them on because specific hospitals are named here, and you can actually look into that. I want to come to the big word at the moment, which is tetanus.
Yes.
And the controversy over this tetanus jab. I don't want to take us back into the controversy, but ask the question, what is the way forward in terms of, number one, ensuring that this jab is safe, number two, ensuring that you have the trust of the people, because what does happen if Kenyans don't get the jab?
So let me start by saying then really thank the joint committee of experts that was from government and also the church. One of the first statements they issued, the final statement they issued, was to say that the vaccines are safe. They also say that vaccination remains an important part of public health intervention. So largely the committee did endorse the role of vaccination in public health. So this particular issue of tetanus, I think it has dragged on, we have discussed it, and the conclusion was, let's be extra careful, all of us. And moving forward, some of the lessons we're learning is that we need probably, before the future campaigns, although the committee did endorse, even the church did endorse the issue of campaigns.
Endorsed it, but came back with a statement thereafter. And so the big question is, how do you ensure they feel safe and comfortable, and that the Catholic Church feels confident that this jab is what it should be?
What we have agreed as a part of the consensus was that in future, we need to engage our stakeholders more aggressively, ensure everybody who has a stake is brought on board. They bring those issues before, and we address them collectively as a group. So one of the things that can come out there is that we need all of us to work as one team. We need to engage our stakeholders so that anybody with any doubt is addressed. Remember, the issue of access to health, the issue of safety, it's paramount. I mean, everybody has the same interest to ensure that whether any medicine, vaccine, or any health product in this country is safe. So we all study from the same platform. We may differ how to do it, but largely we all say it's the interest of, we have the best interest of this country to ensure that our vaccines are safe, and we have mechanisms to ensure that does happen. So we have agreed in the future we'll be engaging everybody, the churches, the faith-based organization, anybody who has a stake, and we all address all these issues. Any concerns addressed collectively, and all of us feel that it's okay and we can now move on.
At the end of the day, it's the interests of the public that are most important. A lot of questions about cancer care in the country, and people are appalled at the level of the lack of facilities, lack of equipment for cancer care. What are the plans around that?
Okay, we have a two-phase approach. The first phase, we invest in 4.5 billion shillings, improving equipment in the hospitals. In the second phase, we have equipment for cancer management, and we've already identified a number of health facilities that will be upgraded to be able to offer quality cancer management and treatment services. Well, currently is only in public facilities is Kenyatta, and Moi just starting up, but we want people in their counties to be able to access services. So we are reorganizing services. We're going to invest in new equipments, particularly for radiation this year.
Give the public a timeline for that.
So what we are committed is by December, we are going to improve and strengthen a number of health facilities to be able to offer quality health services. So we are going to have primary health facilities starting off, but also we have center of excellence for all referral cases. So we are improving on diagnostics, we are also improving therapeutics, so that in Kenya, we have no reason to send somebody to India or any other country for cancer management.
Thank you. Our time is up, but your questions have come in and we've shared many of them. Many of them are very similar. We're going to give all the information that's come in to Dr. Muruguri, and we hope that you will take action on all that is being reported. I must say it's heartbreaking to see some people actually sending their conditions to us, what they're going through at personal level, and this means they don't have access to doctors. They're looking for anybody. So please tell us where you are, even as we send this information through to the Director of Medical Services. Thank you so much, Dr. for joining us.
Thank you.
Now,